Good morning, good afternoon, good evening to everybody that has managed to join us. It's wonderful that you've managed to join, and we look forward to more people joining in the next few minutes. I'm Samantha Shan, and I'm the president of the World Federation of Occupational Therapists. And I'd like to welcome you to the third in a series of webinars regarding the WFOT Global Strategy for the Occupational Therapy Workforce. This is our third webinar. The first webinar looked at introducing the global strategy from WFOT, and our second webinar looked at leadership and advocacy and how we need to amplify our voice as occupational therapists. The previous recordings and answers to any questions can be found on the WFOT website. But today's session is all about data collection, data and research, and why that is important to us as occupational therapists, but also the WFOT Global Strategy for the Occupational Therapy Workforce. We've got a range of speakers internationally with a range of expertise, and I'm looking forward to the discussions that happen over the next hour. If you have questions, please pop them into the chat and we'll either try to answer them here within the chat or we'll answer them after the webinar. But again, they will be found on the WFOT website with all the other resources. So today's speakers range from our project leader to our executive director to colleagues from Australia and Colombia. So I'd first like to introduce Tiago Jesus, who is our Workforce Strategy Project Lead. Tiago, please could you take over?
Thank you, Samantha, for the wonderful introduction. Today I'm speaking about this workforce data and research part of our strategy. So this is just an initial slide to allude that this is a piece of a puzzle. So the development and use of workforce evidence is one of the strategic directions of the WFOT global strategy that was launched and available in the website. We are going to speak about that piece, as well as, of course, research evidence is based on workforce data. So there's an obvious link with a topic number one as well. So for today, the contents are what's the problem and the opportunity here for developing and using data for research and for an evidence-based advocacy. It's important to understand that this is not only for researchers, because not only about the development, the production of workforce research evidence, it's also about the use of that evidence for an evidence-based advocacy. So it's also of interest to those involved in the advocacy endeavors. For understanding the problem, and this was derived for the scoping review results that we use even for developing the own strategy, but we are going to also highlight here, and are going to provide some elements of the strategic directions on workforce research that we developed for the WFOT's workforce strategy. So about the problem and then the opportunity. So starting with the opportunity, we kind of need workforce research data to enable an evidence-based advocacy. On one hand, we need to identify and understand where are the workforce gaps, be it on the supply of the workforce or lack thereof, on an equitable distribution across geographies and practice areas. And by geographies, not only across countries, but also within countries, among rural and other areas. Are going to have today a very good presentation about that on trying to map the occupational therapy workforce. Going to be a very interesting example of how to leverage on this opportunity, about competency, about productivity and well-being of the workforce as well. So research, it's important to identify where are the gaps. Where are the gaps in the occupational therapy workforce? But it's also important for studying the impact of strengthening activities. So we want to understand or use research evidence to understand the impact of workforce policies, programs, and interventions to reduce those gaps. It may be, for example, recruitment and retention packages for a more equitable supply of the occupational therapy workforce, any in-service training activity for those that are moving from a clinical practice role to a more managerial role, etc. So for that, the occupational therapy workforce research needs to be developed and, as I was mentioning, used as well. So this is of interest to both researchers and those doing an evidence-based advocacy. So what has been the problem that we have been identifying? And we conducted a multi-pronged scope review focus or that found some weaknesses, and those were related with the volume of the research, that was not much, with its growth over time, with the study designs there that are not much advanced in many cases, the research methods, the lack of funding for doing that, geographic distribution of that research. You're going to see some of those weaknesses as well as in terms of content coverage, because there were many topics that were barely addressed. So going deeper on that topic, understanding that problem, and based on our scoping review results. So we did, for developing the workforce strategy, we did engage in this large scoping review, also with a situational analysis, and informed by advisory group in interpreting those results. So to provide a little bit of background, we first developed the protocol to that scoping review and what workforce research means with that. So in that protocol, we define a lot of categories of workforce research, and those can be here synthesized in these 5 elements. So we were looking for research in terms of OT workforce research in terms of workforce supply, need, demand, and forecasts, in terms of workforce employment, mobility, and distribution. Also topics related to career attractiveness, recruitment and retention of occupational therapists, any workforce management, productivity, well-being activity, any broader political or workforce government regulation or policy approach as well. And for that, you might expect that we should have a lot of research worldwide for all years, but those results were not there. So we didn't have in any single year more than 6 papers worldwide for all those topics combined, not for them individually, but then combined. So that's why the volume of this research was not that great, as also there was an anemic growth, as you can see over time. There are even some recent years with zero, in 2012 and 2010, with zero research papers on these topics. Also, the study design was not ideal, so we had a lot of surveys were cross-sectional, which have value, no doubt, but we had a lot less pilot and experimental and pre and post-test activities. So that topic of strengthening the workforce and trying to evaluate what happens there was a little bit neglected in that regard. And in terms of types of findings or categories of findings that were generated from that research, we published a paper out of that. We've seen some trends that were very country-based. So the topic of attractiveness and retention was particularly relevant for Australia. The topic of supply and demand was particularly relevant for the United States. We had a topic of the integration of international therapists in Canada, and essentially the takeaway is that there were eventually one major topic per country, but there were not the other topics were not addressed in that context. So there are probably not communication channels here trying to understand what are the topics that are relevant to across nations as well. And some of the limitations that we were finding as well that enable our ability to set up recommendations for this topic were, as we've seen, an over-reliance of cross-sectional and descriptive studies without follow-up. So this is not a very strong type of evidence for an evidence-based advocacy. There are also lack of longitudinal studies and experimental approaches. Most of the studies that we were finding were with small convenient samples, often from just single settings or regions that did not enable any type of comparison. So we ended up more often than not with descriptive results that we cannot compare whether those were greater or lower than another setting or with other profession. So that was very limited. There was a limited use of inferential statistics and standardized instruments, so which also provides some weaknesses to the results. This is very interesting. We're finding a lower rate of funding support. Only 20% of those articles we reviewed, and were 50 to 60, have funding support, and there are other research out there showing that health workforce research overall is funded by over 50%. So there is a clear gap here. Most of the findings were kind of outdated. Despite we need to continuously update that research evidence because we need to reflect updates in policies, in health systems, in labor's market. So what happened 20 years ago, it's not necessarily what's happening right now. And in low and middle income countries, only accounted for a total of 11% of the occupational therapy workforce research publications, which is also disproportional for the number of countries and population in need, etc. So some strategic directions that we were drafting and then refining out of this for the WFOT's workforce strategy. So for this topic in particular, we developed this strategic direction, major strategic direction on development and use of workforce evidence, and it was set as the need to foster the development and utilization of scientifically sound, and by scientifically sound, with those better methods that were kind of finding a lot of gaps there, solution oriented, because we were finding a lot of topics that were just characterizing the occupational therapy workforce, but were not focusing on how to improve the workforce, its distribution, or its competency, or its production, or whatever is the topic, but it was not often focused on the solution. It's just often characterizing. And context-sensitive occupational therapy workforce research, because we have this type of research in Australia, it doesn't mean that we should also develop it for other countries as well, because we need to have that specific information for other countries as well. And then, for example, that includes developing national and international workforce research structures, networks, and research agendas. And this is even a dissemination activity here with this webinar, and try to develop that dissemination of information a little bit, but also to use findings to systematically inform and evaluate workforce policies, planning, regulation, and management practices. And this is why this is part of a global strategy that also addresses those elements. And we also had webinars on the leadership as well, and we're going to have a webinar on the management as well. So these topics are pretty well connected. The role of research here is to always provide evidence to both inform the development of those policies, regulations, and so on, but also to evaluate the impact of those as well. So some examples of action. This is not exhaustive. So if you're going to search or look at the overall search strategy, you're going to see more examples of this, as well as in the hub, but just providing some to provide a glimpse. So we can leverage the use of existing workforce data sets for producing secondary research, and even for determining representative samples of participants, not those convenience samples that we're using. So that's why it's also very important to strengthen the workforce data to enable this secondary research. And secondary research means using data that already exists for an inquiry of that data and for providing evidence out of that data. So that's why it's very important to strengthen the data that already exists, so we can use that for research as well. So we also recommend the use of cross-sectional survey and qualitative studies, which was the most frequent type of studies that we were found, but essentially to inform the development and understand the implementation impact of more advanced and solution-oriented studies, such as longitudinal studies and experimental research or action research, not as a one-off standalone exercise. So one of the weaknesses of that research is that we have those studies as one-off. So we have a cross-sectional survey that's characterizing, and that's it. Or we had a qualitative study that was not really building on the previous evidence and not being followed up by anything else. So these methods are important, but essentially are important as first steps to enable further research as well. So we need kind of follow-ups. And we really need to develop more experimental studies to assess the real-world effectiveness and implementation of any of those workforce strengthening solutions, either for human resources programs for improved performance, policies or packages for improvement recruitment or retention in underserved areas, and so on. So we really need to advance that in the upcoming years. A last slide and some other examples of action. So we also need to build the capacity to do that. We need to have more funding for doing that. Those 20% rate was not clearly enough. So we may need to develop and market funding mechanisms for OT workforce research. As well as for other forms of OT research, but also for OT workforce research, which is very important for the development of the profession. You may need to further develop either research centers or networks or collaborations, even internationally, to have more scale for do that. Focus on occupational therapy workforce, and in those could be profession specific as well as cross professional, comparing the occupational therapy workforce with other professions. But we need to have OTs there in those cross professional research centers focus on that. We need to promote the use of occupational therapy research findings to inform health workforce policy, planning, regulations, and occupational therapy practices. And by the key word there, it's use of. So this is not something only for researchers. We need leaders of the professions knowledgeable about what is the research being done out there, or even informing. We need this type of research on this topic for our evidence-based advocacy. So this is one of the pieces of the puzzle, but this workforce evidence, it's meant to enable all other pieces of that workforce strategy. Essentially, it's the evidence-based element that we need for all other strategic directions that we need to have for strengthening the workforce. Thank you very much for your attention.
Thank you, Tiago. That was wonderful. I think, it's really important that you take us back to some of the relevant studies that are already out there, but this real focus on how we need to be looking at more research and data that is solution focused on occupational therapy, but also I think a very clear message that it's not just about producing the research. We need to get better at how we actually use that research and data. So thank you very much. And next, I would like to introduce Richard Ledyard. Richard is the WFOT Executive Director, and he's going to talk to us about the WFOT Human Resources data and the resources available to you. Thank you, Richard.
Thank you, Samantha. Thank you, Tiago. Welcome, everybody. I'm going to describe the World Federation of Occupational Therapists' role really around how it advocates and uses workforce data. And one of the important roles that we have as an organisation is collaborating with our member organisations. WFOT is a federation of 111 regional and national occupational therapy associations. And together, we collate and advocate for different elements of occupational therapy. So building on what Tiago just said is around workforce data and why it's important. We collect workforce data so it can be reliable, and it can showcase the number of occupational therapists, students, and assistants. We look at work locations and settings, education, experience, and specialization. It enables us to look at age, gender, and retirement trends within the profession and the distribution of the workforce across different regions. And that can be collected through national registers, professional bodies, our member organisations, employers, government organisations, and surveys. So it's important for health workforce planning, understanding what the current capacity within occupational therapy is and forecasting future needs. It helps us look at policy development and making evidence-based decisions around education, regulation, and the scope of practice. It helps us understand where resources are allocated and identifying areas of shortage or underutilisation. It helps us look at education and training and aligning occupational therapy education programs with future service demands. And also equity and inclusion, identifying trends and disparities based on factors such as gender, age, and culture. So as part of our important role with our collaboration with member organisations, we have consistently been collecting data from member organisations within the profile of their own countries or territories. And we've been doing that consistently since 2006. And data collection happens every 2 years. And it is an enormous undertaking sometimes to try and understand and locate where this data is actually located. But on average, we receive around about 95 to 98% response rate from our member organisations. And if you are interested in looking at the trends and the different results from previous projects, that's all available on the WFOT website. What I'm going to share with you today are going to be the results of the 2024 data collection. And data collection spans well over 70 slides, and I don't have time to do that here. But I'm also going to introduce a new interactive tool that's been developed with the 2024 data. And I just want to say a sincere thank you to the member organisations who have contributed to this project. So in 2024, we surveyed 105 national member organisations, and we received a 98% response rate from the countries that are listed there. I realise this slide is quite small, but this is just to give you an indication of where we can see very high numbers of occupational therapists, but equally low numbers. And those low numbers are integral to us also supporting the development of workforce strategies, liaison with government, and a lot of the different strategic directions that are in our global workforce strategy. So on this slide, you can see there are large numbers of occupational therapists in the United States, the United Kingdom, Japan, Germany. But when you look at that data through a different lens, through the numbers of occupational therapists per 10,000 head of population, it tells a different story. You can see here that there are large numbers of occupational therapists per head of population in the Scandinavian countries. This data set also helps us understand and look at the provision of education and how many education programs meet the minimum standards for the education of occupational therapists outlined by WFOT. We have large numbers of education programs similar to the large numbers of occupational therapists in the countries that I mentioned before. We also collect data on students, assistants, and here you can see the concentration of occupational therapy assistants across member organisations, large numbers in the United States, but other large numbers also in relatively large numbers in Hong Kong, Nigeria, and Turkey. And through collecting this data, you can see here, we've been able to see that the increase in occupational therapists globally since 2006 to 2024. And if you look at that from a trend analysis point of view, you can see on average that the occupational therapy growth, biennial percentage increases, average around about 9% a year. So what does the data tell us? If we look at those trends analysis that we've mentioned already, we can see that there's been a 155% increase in occupational therapists between 2006 and 2024, a 51% increase in the number of approved education programs, 67% increase in students, and a 59% increase in occupational therapy assistants. Nearly 3/4 of all occupational therapy education programs meet the minimum standards of occupational therapists. And with 10,000 head of population data, you can see we have huge variations with some at 24 occupational therapists per 10,000 head of population versus 0.01 on the lower end. We also can look and see where workforce shortages are occurring. And we can see here that nearly 30% of member organisations report shortages in mental health. Similarly, 21% in paediatrics and around 15% of those providing support for people with dementia. So I realise a lot of this data, there's a lot of slides, there's a lot of information here. And I think one of the important things that we've invested our resources into is developing this into a much more interactive data set. So I'm really pleased to be able to launch the WFOT Human Resources Project interactive data set here. Now, you will see on the slide, we won't have time to go through it all, but what I wanted just to was highlight a few of the areas that you can explore with this data. So down the left-hand side, you can see that there is a navigation menu. And if we click to the number of practicing occupational therapists, for example, you will be able to scroll down and see this information from different countries. So this was the same information that I presented in that PowerPoint slide. However, it's here in much more interactive data. So if you also scroll down, you can see the different variations again with the practicing numbers of occupational therapists per 10,000 head of population. Now, the benefits to what we've created here is the fact that you also are able to download this information and you can navigate to the different tools here where you can actually download the data in different formats in either PDF or Excel. You can also share the data. So each of these different pages, there we go, thank you, that shows the download. You can also share the information through a link. So each of these different pages can be shared if you wanted to encourage people to visit or explore this data. There's also the option to toggle and filter. We've coded the different countries by different regions aligned with the World Health Organization. So if we use the region of the Americas, this will then simplify the data to look at those countries specifically in that region. And again, you can export this data. And there's a wealth of information here. If we look at where shortage, if we look at shortages, you can explore where some countries experience different shortages across different practice areas. So, and also then towards the end, the conclusion, we provided the same summaries that I presented before and also explored the different areas of practice with high vacancy rates, practice areas with shortage of occupational therapists, and the factors impacting on the shortage of occupational therapy funded positions. I hope you We'll be sharing this, and we'll be posting this through our different online platforms. But I really hope you are able to engage with this different with the platform. I think it's really exciting to be able to have access to this as a resource for the whole profession. So we've got this data, but why is it important? And with strong data, we can show the value and impact of occupational therapy in health systems. We can advocate for greater investment in services and workforce development. We can highlight the inequalities such as urban and rural divides or gender disparities, and demonstrate our contribution to universal health coverage and rehabilitation, for example. So what can we do? I think everybody has a role in this. As professionals, educators, and leaders, we can advocate for better data collection and collaborate with health ministries and regulatory bodies, using standardized reporting methods and working with our member organizations who are also developing strategies. Reliable data is a luxury. It's not a luxury, it's a foundation for strengthening our profession. And again, this is tied back into this global strategy for the occupational therapy workforce, with the use and research associated with the data that's being generated. I will just mention briefly a little about the International Standard Classification of Occupations. And this is a system developed by the International Labour Organization to classify and organize jobs and occupations into a standardized framework. It's used globally for statistical purposes, labour market analysis, and to facilitate international comparisons of occupational data. This is really important, and unfortunately, occupational therapy is not classified within this very important document. We're classified as a health profession, not elsewhere classified. Being included into the International Standard Classification of Occupation puts global recognition of a profession which can influence national labour policies, workforce planning, and access to international funding with support. It can also help standardise job roles and qualifications across country, promoting mobility and equitable labour practices. So as part of a consultation that's currently underway, WFOT has been involved in our discussions around providing standardized information about the profession. The reclassification and the classification of different professions is a long process. And yet, we work with the International Labour Organization to advocate for the inclusion of occupational therapy. This could take time. So one of our collaborative work that we have been doing more recently is working with the World Health Organization to include occupational therapy in the National Health Workforce accounts. It's a pilot project where we're collecting data on workforce from 25 different WFOT member organizations that can look at workforce distribution, proficiencies around the profession. And if it's successful and the trial proves conclusive, we will be able to include occupational therapy in the National Health Workforce accounts. This is really important because what it will mean is that governments will be mandated to interact with our national organisations around occupational therapy and statistical information that they can also provide about the profession in each of their countries. It will also help with the categorisation at the ISCO and including occupational therapy in there. One of the other initiatives that we've recently launched is an interactive platform. As Diego mentioned, there is some work happening, but there's also work happening that isn't published. And we've created a repository, an interactive platform where people can actually share what they're doing and also look and search for different initiatives to help support the workforce data collection and research that's associated with it. So I do encourage you to visit that platform, submit information, and do explore what the resources are there. I realise that's been a lot of information. I'm very grateful for your attention. Do let us know if you've got any questions, and we would be, as I said, we'll happily share the launch of this tool shortly after this webinar.
Thank you, Richard. Thank you for highlighting all the resources that are available through WFOT, but also some of that important work that's going on with the International Labour Organization and the World Health Organization, recognising that WFOT works very closely with our member organisations in that work. I think it's always exciting to see the human resources data, and I know people get really excited by those slides, and fantastic work on the interactive data tool that we'll be able to launch. And I hope that everybody can use that tool and we can really start to advocate more clearly using occupational therapy data worldwide. So thanks, Richard, for that really interesting presentation. And moving on there, thinking about what we're doing with our member organisations and what's happening around the world, I'd now like to introduce Karen Hayes. And Karen is going to speak to us today about workforce data and identifying needs in rural Australia. Thank you, Karen.
Thank you, Sam. So hi, everyone. Yeah, my name is Karen Hayes and I work as a lecturer at Charles Sturt University, which is a regional university on a campus in a beautiful rural town called Port Macquarie on the east coast of Australia. And I'm also a PhD candidate at Western Sydney University, which is where I completed my undergraduate degree in occupational therapy 25 years ago. I would like to acknowledge that I live and work on the unceded lands of the Biripi people and pay my respects to elders both past and present. And I'm really excited to share some of the work that I've been doing with Australian occupational therapy workforce data to identify needs in rural Australia. And I want to acknowledge that I'm doing this as part of a PhD program, and I have a team of wonderful people from across 3 universities, including Charles Sturt, Western Sydney, and the University of Wollongong. So the key central thesis of my work is that inequity has spatial factors. So that is where you live significantly impacts your experience of justice. In particular, my focus is on rural places because globally, rural living people tend to die younger, experience higher levels of chronic disease, injury, poverty, and unemployment, all while having poor access to services, including health and education. So my research aims to highlight these inequities, particularly in Australia, which is one of the richest countries in the world, but consistently provides significantly less to people in rural places. So I'm using workforce data to demonstrate the spatial injustice experienced by rural people when accessing health services. So the work that I've done so far supports 3 of the WFOT workforce strategy elements. So element 2, workforce need and demand. I'm particularly interested in the inequitable distributions of the occupational therapy workforce, and we've been comparing the number of occupational therapists with populations of people likely to use occupational therapy in Australia, particularly those with disability and chronic disease. I've also been examining data linked to element 4, workforce distribution, in particular identifying disparities in population access, where I've been looking at the number of OTs compared to the total population numbers and the level of rurality over time to see what our rural distribution is and if that distribution is equalising over time. And I've also been considering some of element 5, particularly with regard to diversity, where I've been looking at the differences between the different practice areas that occupational therapists in regional and metro areas work in, and the inclusion of First Nations Australians in the occupational therapy workforce. So I've been really lucky because I've been using data sets that already exist in Australia. So we are really fortunate to have the publicly available Department of Health National Health Workforce Dataset, which includes data about all registered health professionals in Australia, including OTs. And the data is collected during annual registration and de-identified and published annually, usually with about a 2-year lag. We're also really fortunate to have the Australian Bureau of Statistics, which publishes data sets from the 5-yearly census and other surveys that they run in between the census. Now, like all data sets, these ones have their positives and their drawbacks, but they provide a great overview of what's actually happening in Australia. And I've also been able to access data sets of the location of lots of relevant infrastructure, such as where schools and hospitals are. Unfortunately, though, for my research, the Bureau of Statistics and the Department of Health use two different levels of remoteness. So one has 5 levels and one has 7. So the Health Department uses the modified Monash 7-level measure. And since they're the people that I most want to influence, I had to find a way to transfer the Bureau of Statistics data into that model so that we could compare like for like. So this map shows the 7 levels of remoteness that are measured by the modified Monash level. And the big area of dark green is level 7, which are our remote areas, which actually cover about 75% of the Australian land mass and have just 0.76% of our population living there. So while the tiny little red areas that you can see on the coasts are our cities, which are level 1 and cover just 0.29% of our landmass, but contain 72% of our population. And the other colours are the levels in between. So the workforce dataset already came in those 7 modified Monash levels, so I could use that data just as it is, but I can't map it to specific locations in Australia. On the other hand, the census data can be mapped to specific locations, which is great because I've mapped populations to locations using ArcGIS mapping software and then remapped it to modified Monash levels of remoteness. So now I can compare apples with apples. But what have I found? Compared to the total population, most occupational therapists work in our cities or modified Monash level 1. And we have around 110 OTs per 100,000 population in 2021. And if we look at the changes since 2013, which are the red areas there, you can see that only levels 2 and 3, our regional cities and large rural towns, are looking likely to catch up if the current growth rates continue. But it will probably take about 5 to 8 years. So this tells me that we're not doing enough to increase our total workforce in rural places. Worse, if we look at the populations of people likely to need occupational therapy, so people with chronic disease, disability, or aged over 65 years, the number of OTs compared to these subpopulations falls away more steeply as soon as we step out of the city. So basically the rates of illness, disability, and the age of the population is higher in rural areas, so they have a higher need. So this tells me that even if we matched the number of OTs to total population across the levels of remoteness, we'd still have inequity as the need is actually greater in rural areas. We need more OTs per head of population to provide equity. So considering workforce diversity, one area that I've also examined is how OTs are funded. So Australia has had a huge funding model change between 2013 and 2018 with the introduction of a National Disability Insurance Scheme. And this scheme allocates funding to individual people and they then engage healthcare workers privately, including occupational therapists. And this appears to have resulted in a significant increase in the number of hours worked in the private sector from 71 hours per 100,000 population to 171 hours over 9 years, while the public sector hours have remained relatively steady. So this represents a huge increase in the number of people accessing OT and has led to an acknowledged workforce shortage across all of Australia. But if you look across the remoteness levels, you can see that this increase has not been evenly shared. Most private sector growth has been by OTs working in the first 3 levels of remoteness. While there's been some public sector hours increased in the rural places, these increases haven't matched the increases in the more metropolitan areas. And in our small and medium rural towns, level 4 and 5, public hours have actually decreased, despite having less than half the increase in private hours of the metro places. So this suggests market failure of the National Disability Insurance Scheme funding for rural places. And the government may need to direct further resources to the public services in these areas. Still on workforce diversity, I examined the proportion of First Nations people included in our OT workforce. This is really important in Australia because we know that our First Nations people have the poorest population health outcomes, and that including First Nations people in the health workforce is one effective way to increase First Nations health access and outcomes. So right now, occupational therapy in Australia is doing really poorly, with just 0.76% of the workforce identifying as First Nations people, compared to the population levels of 3.2%. So looking over time, you can see that the First Nations workforce has increased, but the current workforce growth rate is climbing more quickly. So that's the red line. Then the First Nations inclusion, which is the black line, which means that we'll never reach parity at the current rate of inclusion. So this tells me that we need to have a hard look at how we as a profession might be excluding First Nations people. And looking across remoteness levels gives us another clue. Most of the growth in First Nations workforce inclusion is in our cities, with very little growth at all in our rural places. And this is really concerning, as our cities, while having a high number of First Nations people, still have the lowest population rates of First Nations people at 1.8%. So while more than 40% of our remote populations identify as First Nations people, there's only up to 3 First Nations people in the very remote workforce. And I say up to 3 because that's the lowest number recorded in the data to prevent identification of individuals. So this tells me that we need new strategies to include rural and remote First Nations people in our workforce. So that's a sample of some of the workforce data that I've been playing with. There's a lot more, and how I've been analysing it. My next steps are to try and influence policy by highlighting this data. I've had one publication released on rural and remote healthcare and the case for spatial justice, and I have 2 data-focused manuscripts under review at the moment. My future studies will include comparing workforce numbers with things in the environment, such as schools, universities, and hospitals, and looking into the lived experience of occupational therapists working across all modified Monash levels. And finally, I'm getting into some impact work where I'm trying to influence public opinion and politicians. So thank you so much. I'm very happy to talk to anyone who's interested in workforce data, so do feel free to reach out. And thanks for the opportunity today.
Thanks, Karen. That's really fascinating. There's some really interesting figures there that will hopefully inform future research, but also hopefully future practice. And I think, as you highlight, looking at the need to explore sort of the funding of services, but also that inclusion, not just of First Nations, but around the world of sort of like more disadvantaged populations. So thank you for sharing with that today. Please remember, if you're on the webinar, if you have any questions, you can put them into the question and answers, and we'll either try to answer them during the webinar or afterwards during the WFOT resources. So our next speaker is Pamela Tolero. And Pamela is going to talk about the collection of Colombian occupational therapy workforce data, recruitment, methodological strategies, and lessons learned. Thanks, Pamela.
Thank you so much. Hello, everyone. As Sam said, I'm Pamela Tolero Cabrejo. I'm assistant professor at Thomas Jefferson University. However, today I'm speaking as the first alternate delegate representing the Colombian Occupational Therapy College, or CCTO, at WFOT. So today, I will talk from my position as delegate, sharing the process, lessons learned from Colombia's OT Association's effort to collect occupational therapy workforce data in the context of WFOT's global workforce strategy. So in the next few minutes, I will provide you some brief context about our national association, the CCTO, and WFOT's global strategy for workforce development. And then I will introduce you to the hashtag Yo Cuento, or I Count project, describe our recruitment and methodological strategies, and finally reflect on the lessons we have learned through this process. So first, I want to acknowledge that I represent our Colombian WFOT delegation, which comprises Delegate Aida Navas de Cerrato as primary delegate, Karen Aguiar Rojas as the second alternate, and myself as the first alternate. Today, I'm representing their voices, but also the voices of Colombian OT colleagues led by the CCTO who have participated in this collective effort. The Colombian College of Occupational Therapy, or CCTO, was founded in 1972. It is Colombia's national OT body and our voice internationally through WFOT. Occupational therapy is legally recognized in Colombia through a law, 949 of 2005, which defines academic, ethical, and practice standards. And this law and the professional competencies document created in 2016 by a commission from the CCTO have been critical in collecting and analyzing workforce data in our country, especially concerning our practice domains. Another important marker here is the National Registry of Healthcare Workers. So upon graduation, OTs must register with the Colombian Ministry of Health through RETUS, which is the national registry verifying that health professionals have met the legal and academic requirements to practice. So as 2024, we had 6,007 OTs registered, so about 1.14 OTs per 10,000 head of population. However, data from our 12 accredited OT programs suggests that about 8,400 graduates that were collected in 2023 were in the country. So raising questions about workforce tracking, because once you register, you are there forever and there is no follow-up. So scholars like Gomez, Trujillo Rojas, and Duarte Cuervo have emphasized the need to better understand our workforce in its geographical distribution, competencies, history, and background, which motivate us for this initiative. Now, at the global level, advance over here, WFOT's global strategy for the occupational therapy workforce calls for better workforce planning, visibility, and evidence, as you have seen in other presentations. And Colombia's national initiative was developed directly in alignment with this strategy and the WFOT Human Resources Data Project. Understanding who we are, where we are practicing, and what barriers we face is critical for national planning and advocating for our professional, both at a national level and an international level. So this brings us to our project. Pardon me, I'm going to go back here. Good. In 2023, the CCTO launched hashtag Yo Cuento, meaning I count, a name that played on the abbreviation of OT in Spanish. Our slogan, No hay cuento sin ti, there's no story without you, aimed to create a sense of collective ownership. We adapted a WFOT survey for human resources to fit Colombian realities, and we launched a two-phase digital campaign targeting academic programs with a different questionnaire about their student and graduate pool, and another survey for practicing OTs that was designed to capture the geographical, age, and gender distribution of participants, the universities they graduated from, multiple job holding, their areas of practice, other areas of practice not represented, the financial and social resource gaps, and practice growth areas. So through social media, WhatsApp, Telegram, LinkedIn, Instagram, Facebook, and formal emails, we reach OTs across Colombia. The result is that we collected 757 responses, and after validation, we analyzed 748 surveys. Now for the recruitment, we use cluster, snowball, and convenience sampling, academic programs, professional networks, and CCTOs, digital channels help spread the word. eligible participants were practicing OTs in Colombia, whether Colombian or foreign trained. Participation was voluntary with informed consent, and identifying information was deleted after verification to ensure anonymity. You can see over here some of the pieces that were used. Now, from a methodological standpoint, JotForm offered an accessible platform. Using WhatsApp and Telegram proved crucial, especially for reaching rural and urban practitioners where these apps are widely used. We crafted visually appealing, culturally relevant messages, emphasizing, for example, as you can see in the previous slide over here, very slow going back. There you go. Today we count 430, but we know that we are more. Help us find how many and who we are and where we are at. Now, another strategy that worked for us was that on the Colombian National OT Day, November 17, we shared preliminary demographic findings publicly to show transparency and encourage ongoing engagement in further workforce projects. Several lessons emerge. First, digital strategies are feasible, but a dedicated sustainable platform is needed for ongoing workforce data collection. Second, securing funding is critical for making this a recurring effort, especially on the data analysis. Third, future surveys should include OTs working abroad, those who have left the profession, information on salaries, leadership, and unpaid work. We also noted discrepancies between the RETUs and our findings, suggesting the need to improve registries and greater workforce visibility. And ultimately, strengthening workforce data is essential for reinforcing professional identity and amplifying advocacy, especially in underrepresented fields like rural health and mental health, which my colleagues also have referred today. Here are the references that I have used for this short presentation. And in closing, the Colombian experience demonstrates in a very quick way both the promise and the challenges of collecting workforce data in contexts like ours. The lessons we learn offer, I think, valuable insights for others embarking in similar journeys in Latin America and beyond. And thank you very much for your attention.
Thank you, Pamela. I think it was a very clear example of a local adapted sort of like need and looking at the needs rurally and within sometimes challenging circumstances of collecting data. And I absolutely love the use of the hashtag. So thank you for sharing that with us today. As usual on these webinars, we've had an awful lot of information. Please do go and maybe look at the recording of the webinar on the WFOT website, as well as recordings from the previous webinars. Our next webinar will be in June, which is on workforce management and retention, and we'll release the date of that webinar on our usual social media resources. So thank you for joining us today. Thank you to everybody behind the scenes on the webinar. I know this takes a lot of work to put together, so thank you for everybody there. But most of all, thank you to our speakers. There was an awful lot of excellent data there, so thank you for your time today, and look forward to the next one. Thank you very much.